Hello, I'm Dr. Brandt Gibson, and tonight I want to talk to you about why I don't use Lyrica or other medications typically for peripheral neuropathy. Now, let me give you a little bit of background. So for many years, I used Lyrica, gabapentin, amitriptyline, and Cymbalta as treatments for peripheral neuropathy, as options for individuals with significant nerve pain, significant night pain that was keeping them from being able to sleep and so forth, and was getting pretty good results. Did they work for everybody? No. Were there side effects? Yes. And in some individuals, they were not a good thing. I had patients where they would have weakness, where they'd have difficulty moving their legs, or they'd have difficulty with balance and feeling too drowsy and so forth, and some of these side effects. And in those cases, we would typically take them off of the medications. But I would still use them because they were so effective and they were working for enough individuals that they was still one of the better options. Several years ago, my mother was diagnosed with metastatic lung cancer, and the cancer started to spread and it started to go to other places, and it got to the point where it was bad enough that she required some radiation treatment. And with some of these treatments, she got pretty significant nerve pains in certain areas, including severe nerve pains to her legs and her feet. And the pain got severe enough and problematic enough that in discussion we decided a good option for her was to try Lyrica and to go on to Lyrica for these symptoms. And as she started taking Lyrica, she hated the side effects. She hated the way it made her feel. She felt like she was getting weakness and inability to do some of the things she'd normally do, and sometimes it would make her agitated, and she wasn't really able to continue to use it. So we worked her off of it. We took her off it like you're supposed to. But then she had severe side effects of coming off of Lyrica. And the symptoms were so significant that I'm looking at going, this is an awful medication. And this is not something that I want to recommend and say, yeah, I need to put you on this medication, because there's really three big problems besides all these side effects, and because of the possible problems after the fact. There are three big reasons why using these pain medications or these nerve modifying medications for peripheral neuropathy aren't a good idea. Number one, they don't fix anything. They become a problem, an issue that you're going to use and have for the rest of your life. You're going to have to continue to have these medication, take them over and over and over again. Number two, they become less and less effective over time. Most of the medication, gabapentin, for example, you get used to and you have to keep increasing the dose. Lyrica, you can get to a high enough dose that sometimes it will stay that way, but there comes times sometimes when even that doesn't work. And number three, you're using a Band-Aid. You're basically reducing symptoms, but you're not giving people back their life because of side effects and so forth. My goal in helping individuals manage peripheral neuropathy is to help them eliminate the discomfort, distraction, and disability that comes from nerve pain, to help them improve the damage to the nerves and stop continued nerve damage. These medications don't stop any continued damage to the nerves. The nerves can get worse even while you're on these medications. And number three, we want to give you back your life. We want to get you back doing the things that you want to do, and these medications don't do that. So this is Dr. Brandt Gibson, and this is Neuropathy Nugget Day 189. The reason why I don't use Lyrica or other similar medications and recommend that we more aggressively work on managing peripheral neuropathy.